So we will not waste any time. We will directly start with the remedy. Okay. So first year studying materia medica and studying materia medica in second year, there will be a small difference. See, the beauty of this particular subject, every year when you study now, when you start understanding materia medica, it will be a little different. So I will try to tell you how is it going to be different and we will try to understand. So first year, when we did materia, when we started teaching you remedies, we are mainly focusing on the first year remedies, of course, and we are also trying to integrate with the first year subjects. So what were the subjects we are trying to integrate it with? Anatomy, physiology, pharmacy, and of course a little amount of organ. Okay. Now the beauty that you will be seeing in second year, we will be of course using anatomy knowledge, physiology knowledge, pharmacy knowledge and organ knowledge, no doubt. But what we are also trying to focus is, we are trying to focus on the second year subjects. So we are trying to integrate materia medica with the second year subjects. Okay, fine. So as an example, I just try to take up a very small remedy, very simple remedy, so that the first remedy should not be, too heavy. Fine. So we start with a very small and a simple remedy. And as usual, we'll try our best to keep the class interactive. Okay. So first year, what are the total number of remedies we studied? 50. And you will be seeing in second year, that knowledge of first year we will be using it. Meaning, how do we use that knowledge of first year? So there is something called as comparison, which slowly we will be introducing it to you. Trust me, it's going to be interesting. Right? Just listen to the class. Any doubts, anytime, feel free to ask so that I can clarify. So without wasting time, we'll quickly start with a simple case. And post-lunch sessions, they're very, very tough. And unfortunately, my class is post-lunch. Fortunate or unfortunate, we'll discuss it later. But that's again a very big challenge for the teacher. So we'll try our best to keep it interactive. Please follow this slide. Please follow the PPT. I have a small case that I will be sharing it with you. Through a case, we will try to understand the remedy that we are going to discuss today. Hope I am clear. Okay. So what was this case? This case was a lady who had come to my clinic a few months back. Her husband and her daughter, they are already my patients. Right? So, husband had come for his consultation, and then over phone he just requested me to talk to his wife because she had a small problem. He couldn't get her. Husband and daughter are sitting in front of me, and he's trying to connect to his wife. And what was that case is, she should be a lady around 38-40 years old lady. And when I spoke to her over the phone, she said, "Sir, I have a small swelling in the anal region." Okay? So what is the patient trying to tell me over phone? That she's got a small swelling over the anal region. So this is her complaint. Okay? I am over in expecting an answer from a second year student. But I feel some questions or some inputs will definitely come from your end. And I specifically mentioned, keeping the limitation of you being a second year student, what are the small questions that you would like to ask this particular lady? Assuming you get a case. Naturally, when you get a case, you will be full-blown doctors. You will have a better understanding. But keeping it simple, for a second year student, what would be the probable questions you would like to ask over the phone? Question is clear? So she's got a small swelling in the anal region, and what small questions? What is it? One at a time? Nature of the swelling. Okay, is it hard, soft? Makes sense. One of your friends, is it painful, painless, beautiful, good? See, your responsibility when you come to second year will increase. Every year you finish, you will be reaching the goal of becoming a doctor. But, so you are near to your dream by 1.5 will become a doctor. So what I want to insist here is, you need to become more responsible. Okay, we'll come back. So what is the nature of the swelling was the first question. Is it soft? Is it hard? Makes sense? Anything else? Is it painful or painless? Good, I appreciate. Makes sense? Since when? Yes, absolutely right. Since when? Since today? Since last night? Since years? Makes sense? Yes, okay, good, I'm happy. Since when? Yeah, very good, beautiful. Now, one of your friends also says, sir, you are talking of an anal region. So what we also have to understand here is, do you have any difficulty in passing stools? Are these stools soft? They are hard, whatever. Good question. Any other questions?
Is it smaller?
Okay, very good. Is it small? Okay, very good. I have not mentioned. Yes, it makes sense. Is the swelling small or is the swelling big? Okay. I'll tell you. Now this lady, when coming back to your question, the same question when I asked how big this swelling is. In Kannada, in our local language, kadlekai gatra. You understand? What is it? Shega, peanut, groundnut. So she says approximately the size is that of a groundnut. Very good, groundnut. Hard, soft, yes, that makes sense. Pain, character of stools. One last question you need to ask here.
Any difficulty while sitting?
Okay, any difficulty, meaning is the swelling causing any kind of a difficulty? Good. Okay, what is the character of pain? Yes. One last question. Any? Good, any bleeding? Okay, did the swelling develop after some treatment? Good, very good. I really appreciate it. Must be, when I was in second year, I did not have so much of clarity. So what I have written here is all what you have already answered. Good. So you are told since when that is there, and what complaints you have because of the swelling. You have any difficulty in passing stools, you have difficulty in sitting, you have difficulty in walking. How is that swelling troubling you? Can be a small question. And pain. And in homeopathy, we ask them the character of pain. When is the pain more? When is the pain less? All these questions can be asked. Very good, can be asked. Then anything else that you would like to ask here? Anything else? Or kuch puchne ka? See, last question I also asked, somebody rightly said, was there any bleeding? Rightly asked. Okay. So these are few questions I asked over phone, and a remedy was prescribed. That is the remedy we are going to discuss. Please keep this. We'll come back to this after some time. Why this particular remedy was given is what we'll be discussing a little later. Again, before I go ahead, any wild guess what is that remedy that I am going to discuss? Yeah, asking a remedy might be a little difficult because this is your first class or second year. But then at least, any wild guess, which system is this particular remedy acting? What is that special affinity this particular remedy has? Very good. One of you rightly said J. Hope you have not seen the PPT. Very good. So the answer here is J. Good. Can you be more specific? Did we discuss the entire J? From mouth did I discuss? What is the area we are focusing here? Anal rectum. So the rectum and of course the anus, the anal opening. Okay. So today's remedy has a special affinity for lower GI, meaning it's a remedy which predominantly acts on the rectum. Okay. Now the next question. Post-term sessions will be more of questions. That's how you keep it interactive. Okay. And I'm happy and proud you are also giving a lot of right answers. Okay. Now recall few remedies from your first year syllabus which predominantly acts on the rectum. Very good. Aloes. Yes. Aloes. Ethusa. Cilicia. Good. Ruta. Sulfur. Good. Keep it up. Any more? I thought lycopodium. Good. Many more. Lycopodium. Podophyllum. Good. Beautiful. Out of 50, you have the liberty to choose the right remedies acting on the rectum. Podophyllum, aloes, sulfur, ethusa. tuberculosa, lycopodium, sericia. Somebody beautifully said ruta. I appreciate. What do you have in ruta? Prolapse. And ruta is also a beautiful remedy for cancer of rectum. Okay, good, I appreciate, because whenever we think of ruta, what comes to our mind? Injuries. If you are thinking beyond injuries, I am very happy. Whoever teacher taught you ruta? Prescribe. I can't hear it now. Yeah, good. So what I was saying to you is ruta is a beautiful remedy. Good. Other than injuries, you have. I also heard the word ulcers. But where do you see ulcers in ruta? I don't know, somebody said ulcers, inflammation of JD, stomach, gastrointestinal system, J. It goes into inflammation, it can go into ulcers. Beautiful remedy for gastric ulcers, ruta. Other than the injuries. Okay? So ruta, podophyllum, sericia, very good, beautiful. Good. So slowly as and when time permits, we'll slowly discuss, or we'll slowly compare each of those remedies. Today I'll be starting with a very simple remedy, and you already got a clue that this remedy is a remedy which is predominantly acting on the rectum or lower bowels. Very good. So this is, you would have seen this. The remedy that we are going to discuss today is Aesculus HIPPOCASTANUM is the remedy. A very simple remedy, small remedy. Hopefully next 40 minutes we'll try our best to cover this, and we'll also try to compare few remedies, keeping second years in mind. Okay? So horse chestnut is the common name. Okay? And it belongs to the natural order Sapindaceae. Right? And the part that we use is, if you just see the image here, the part that we use here is the tincture of the ripe fresh nut. So this is just the pharmacy part of Aesculus HIPPO. Okay, beautiful remedy. And we'll try to unfold what else you have in Aesculus HIPPO. See now, at the end of the session, we have some objectives, we have some aim. Now what we are trying to understand is, at the end of the session, the learner should be able to, from this image from first year, we are trying to focus on the sphere of action and pathogenesis of Aesculus HIPPO. This will be my first objective in the post-lunch session. And second, if you just again look at the Google image we have taken, we are focusing on the PQRS. Please go back to the first year classes. We are looking at the characteristic symptoms of Aesculus HIPPO. What is characteristic in Aesculus? Okay, that's the second thing. And third, we are looking at the particular symptoms of Aesculus HIPPO. And being a second year student, though we have a little amount of symptoms mentioned, I will be mainly focusing on liver, rectum and back symptoms of Aesculus HIPPO. We are looking at liver. Important is the rectal and of course the back symptoms, and the rest of the things we will cover it in assignment. Okay. And the last thing that we will be discussing here is the modalities. Mention the modalities of Aesculus HIPPO, and of course, we will also, very important, recall similar remedies from first year BHMS syllabus, which you have already done. You are talking of Podo, you are talking of Allo. We will try to, as and when the PPT unfolds, we will try to relate those remedies as well. Okay? So any quick issues, problems with the objectives? I hope they are very clear. Okay? So this is how systematically we will be taking up Aesculus under the above headings. Done? Okay, so let me go ahead. So now, looking at this sphere of action, again, now this is where our anatomy, which you have already passed. So what I am trying to tell you, from the knowledge of anatomy, what you see here, Aesculus is a remedy which predominantly acts on the veins, blood vessels. Okay, first thing, acting on the blood vessels, it will cause venous stasis. What is it causing? It is causing venous stasis. Second very important thing, what you also see here is, it affects the portal system. Again, from the knowledge of your anatomy, it affects the portal system. It affects the portal system, and what is it causing here is, it again causes portal congestion, very important. So here you see venous stasis, the blood flow is getting slowed down, fine, venous stasis, and second, you also see portal congestion, Third very important thing, the main area is the rectal veins, Acting on the rectal veins, it causes dilatation of the rectal veins, and indirectly what I want to highlight here is, it is causing hemorrhoids. Or in local language, we also call this as piles. Dilatation of the rectal veins. Okay. The last area, what I want you to understand is mucous membrane. Okay. Mucous membrane of throat, mouth, rectum, and it causes dryness. Okay. So, can you recall some remedies from your first year? Acting on the mucous membrane, which causes, very good, beautiful, bryonia. Bryonia. Okay. So, bryonia is one remedy which you can compare a little later. Lycopodium, okay. Any other remedies? Sepia, okay, no problem. We'll come back. So, a remedy predominantly acting on veins. Okay. See, earlier, or if you also read some good materia medica books, they say the action of this drug is more marked on the lower bowel and it produces engorged hemorrhoidal veins. And this is what you already saw. And this is what Dr. Boric says in his materia medica. The opening line of Dr. Boric is this, which I have taken here. Okay. So, the first objective of today's class, I hope you have clarity what is sphere of action. What is sphere of action? Where it acts. What is pathogenesis? Acting on that part, what it does is pathogenesis. Hope things are clear. Simple remedy. And moving ahead, see now, if you go back to your first year syllabus or first year materia medica that we were teaching, this component we were integrating with which subjects? We were mainly integrating with the sphere of action. We are integrating it with anatomy and physiology. Okay. Now, as a second year student, this being my first class, we try to integrate the above with pathology and toxicology. Okay. So, for example, pathology will be done, and you will realize that studying a little more about stasis, understanding what stasis is, can give you a better idea about understanding this particular remedy. So, slowly what we'll do is we'll try to integrate the knowledge of pathology and of course the knowledge of toxicology without disturbing what we have been already doing. So this is an additional thing henceforth we are going to do when we teach materia medica. Okay? Fine? So, the characteristic symptoms. What is characteristic in Aesculus? So what you see here is, for example, again from the knowledge of your applied anatomy, clinical anatomy, what do you see here? You see tonsils and even the pharynx. So, follicular pharyngitis. What is it? Follicular pharyngitis. See, what you have to realize here is, wherever you have veins, those veins are enlarged. Okay? So, like for example, if you read some materia medica, they say piles of eyes, hemorrhoids of eyes, meaning the veins of the eyes are also enlarged. The veins of the throat, the veins of the legs, anywhere you see veins, you see they going into stasis, they going into enlargement. Okay? So, follicular pharyngitis, violent burning, raw sensation in the throat. Throat feels dry and throat feels rough. So this is the first characteristic symptom of Aesculus here. Okay. So going ahead, now from the image you can understand, thanks to Google Images, fine? From the image you can realize that there is also a good amount of constipation in this particular remedy. Now before I tell you about Aesculus constipation, can I have some remedies for constipation? Cilicia, very good. So what happens in cilicia? So stools are hard, they they go what we also call it as very good receiving stools. And stools have to be removed mechanically. Beautiful, good. Silisha. Other remedies? No, brainia. What happens in brainia? Dry, hard, acid burn. Acid burn. Beautiful. Obstinate constipation. Remedy comes very close here. Is straining, struggling, and the stools that are coming out are dry, hard. This is very good. Moving ahead. Any other remedies? Calcarea? Very good, good, correct. See, don't hesitate. Wrong, right, we'll decide it later. At least have the courage to answer. Very important. I appreciate. Calcarea cow. How is it in calcarea cow? Better than constipated. 4 days the lady is not passing stools, she is absolutely fine. She is eating, she is doing everything. The day she passes motion, she feels discomfort. So better than constipated is calcarea cow. Good. Any other remedies? Allospatula. What happens in allos? Constipation? Very good. Marble-like stools which are passed involuntarily. Hard stools which are passed involuntarily is allos. Good. Allos. Any other remedies? Pulsativa. Naxomica. Very good. Chalo, good. Bolo. What happens in Naxomica? One word that highlights Naxomica. Beautiful, good. That's the word I wanted. Ineffectual urging. मतलब क्या? They keep going often. Sir, I feel it is full. I go, I pass, I come back. And after some time I feel like going back again. Why you feel like going back again? Because it is not completely evacuated. So this is ineffectual urging for stools, which is very prominent in Naxomica. Very good. So next one, sulfur. Okay, sulfur, obstinate constipation. Burning, you have it in sulfur. Okay. Ignitia. Fine. What is special in ignitia? Yeah, constipation for soft stools. Why? Ignitia is a great remedy of contradiction. सब कुछ उल्टा होता है. Everything happens the other way in ignitia. Okay. So constipation. And I'll come back to this. See, you also have something very important. Can you tell me from the image, what is it I'm trying to focus next? That in Aesculus, you also have something called as uterine prolapse. Uterine prolapse. Any other remedies from first year syllabus? Podophyllum. Good. Podophyllum. Okay. So what I want you to understand, any of the rectal complaints or uterine complaints, they are associated with back pain. It's a very important concomitant. Rectal complaints associated with back pain. Fine? To that lady, the case that I just discussed with you, she had swelling, small swelling, and local language she was trying to tell you, swelling like that of groundnut, painful stools, and severe backache. That was the combination that made me prescribe Aesculus. I'll again come back to that case a little later. But for time being, what is it that we are trying to understand? We are trying to look at the characteristic symptoms of Aesculus. Okay? So uterine prolapse and acute leukorrhea with lumbosacral pain. See, this is important. Lumbosacral pains and great fatigue. Every time when the lady is walking, she feels that there is the uterus which is coming out. One more remedy you can also think of is ruta, uterine prolapse. Ruta, okay? So restox. One more remedy is restox. Okay? Now what do you see here? What do you see again? The image. What do you see? Okay, I mean, yeah, forgot to say, I'm happy you saw this very minute thing, but you forgot this. Sticks. Okay. See, what is that sensation you have in Aesculus? You have peculiar sensations, but don't laugh at the sensation, because tomorrow patient will come back to your clinic telling you the same sensation. When she said groundnut like, trust me, I have been to practice for almost 27 years now, doing homeopathic practice. First time in my life, around my 27th year of practice, I have a lady telling, I have hemorrhoids and it looks like, I I feel it like grounded. You getting my point? In your own language. Done? So, I have to wait 27 years to get a lady talking about her hemorrhoids, which is resembling like that of grounded. You getting my point? Right? Similarly, you have halos. How is it in halos? Halos is not great, bunch of grapes. So the rectal veins, dilatation is happening and there is protruding, and the protrusion is like that of bunch of grapes. That is halos. Remember in Aesculus, the important thing is dryness as if it were filled with small sticks. Now this is what you have in Aesculus. Very important. Okay. So these are few characteristic symptoms. The last and very important characteristic symptom we have here from the image. So these are rectal veins, and this is engorged rectal vein, dilated rectal vein, and this is what we call it as hemorrhoids. Aloes is a beautiful remedy for Aesculus. You know why aloes came into my mind? Because I was talking of hemorrhoids, and luckily this was looking like a grape. So I immediately connected to aloes. But Aesculus is a beautiful remedy for hemorrhoids. Hemorrhoids which are blind. I'll tell you what blind is. Hemorrhoids which are painful, purplish, burning, and they rarely bleed. So when I say blind hemorrhoids, the old terminology which means non-bleeding hemorrhoids. What is it? Non-bleeding hemorrhoids. So hemorrhoids, again, you will be integrating this with surgery. I'll be talking to you about this a little later. Okay, you'll have to go back home, read the chapter hemorrhoids. Okay, so that it will be very useful in future. So for time being, hemorrhoids which are blind, painful, purplish, burning, and it rarely bleeds. Okay. So any quick questions? Two small components we have tried to cover. What is the first component? Sphere of action and pathogenesis. Any question? Boys, where do you see Aesculus acting? Lower lobes, very good. More so, generally it acts on veins, and again more specifically on the portal veins, the rectal veins, and it causes dilatation, stasis, fine, and it can cause engorgement. Okay, good. First, second thing is inlay mucous membrane, and it causes dryness. Okay. What are the characteristic symptoms of Aesculus? Dryness. Where dryness? See, the dryness in bryonia, you had in all the mucous membrane. So the dryness in Aesculus is limited only to throat, to mouth, and to the rectum. Specifically, it is limited there. Okay. So because of that dryness, what is the sensation the patient is having? Stick-like sensation in the rectum. And in the throat, raw sensation, follicular pharyngitis, constipation, the hemorrhoids are like they hardly bleed, painful, purplish, and like a small grounded. Only remedy in our Medica which has hemorrhoids like grounded is Aesculus. If you are lucky tomorrow, the patient telling this, blindly you can give Aesculus. And it works. And the only other important thing you need to have is the back pain. Okay. Now, I did not mention this under the objectives, but as a second year student, you should also know that Aesculus has some mental symptoms. So mentally, are they happy, sad, angry, surprised, scared, disgusted? How are they? This is what I am trying to share with you. Basically, they are very angry people. Very irritable, angry. More than anger, what stands out in Aesculus is very lazy people. Soma people. Very lazy. Right? Lazy, angry, irritable, and they also are very discontented, dissatisfied people. Okay? And they can also have memory issues. Now this is what you have in Aesculus. Mind. I'm not going more in detail. We can refer books if you want. We'll come back to the particular symptoms of Aesculus. Particulars again, I'm not going from head to toe. Right? I'm not typically going from head to toe. I am trying to focus on areas which are very important. And what are the areas? What are those areas? You'll be seeing that Aesculus has an affinity for liver or the portal congestion or the portal circulation, and it causes portal congestion. And if you go back to your anatomy and if you read, portal congestion can give rise to hemorrhoids. Portal congestion can give rise to esophageal varices and lot of things. Okay. So here you will see portal congestion, liver being affected. Okay. So which are the other remedies from your first year which predominantly acts on the liver? Lycopodium, good. Naxomica, podophyllum. What happens in podophyllum? There is a symptom. Pain in right hypochondriac region, which is better by rubbing. Pain here, and tomorrow you see this patient is rubbing and is feeling better. You can prescribe podophyllum. Okay, you can prescribe podophyllum. Done? So podophyllum, when do you think of Naxomica in liver affections? After alcoholism. Very good. Only alcohol? Very good. Beautiful. Follow. Cat. Cat. Sedentary lifestyle says good. Anything else in Naxomica? Over abuse. Alcohol, allopathic drugs, coffee, tea, quinine, overindulgence in wine, women. That's how Naxomica are. So liver affections in Naxomica. Okay, good. Any other remedy? Lycopodium, podophyllum, sulfur. Sulfur again is a beautiful remedy. Cinchona. I will talk of chelidonium in the next class, which is a predominantly liver remedy. We'll talk of that a little later. But now you also see that this remedy has portal congestion, and they will have severe pain, fullness. Because of portal congestion, because of portal stasis, the liver functions are slowed down. What is it? Liver functioning will slow down. So they will have indigestion, they will have difficulty in digesting things. Okay, feels full, congested, slowed down in its function and sluggish. Then pain in right hypochondriac region extending to back. So the hemorrhoids with fullness of right hypochondriac region. These are few symptoms that you have related to liver in Aesculus. Okay. So to make things clear, we are discussing the remedy Aesculus, which is predominantly a rectal remedy, a remedy which predominantly acts on the veins, okay, and more so it is acting on the rectal veins and the portal vein. And now we are talking of Aesculus action on the liver or the portal circulation, portal congestion, portal stasis, liver becoming sluggish, liver becoming slow is what you saw here. Okay. So moving ahead, very important 5-mark question in your exams, and in practice we use Aesculus predominantly in this particular area. So we will spend some time in understanding what exactly Aesculus can do. Okay. See, when you say rectal symptoms, what are the probable complaints that you can expect? What are the probable complaints? Rectum, related to rectum. You can have constipation, good. You can have diarrhea. Dysentery, very good. You can have dysentery. You can have hemorrhoids. You can have flatulence. More than flatulence, flatus. You can have fissure, very good. You can have fistulas. You can have cancer. You can have growth. Beautiful, good. I'm happy. So, what is it that you have in Aesculus is very important. You will not see much of diarrhea. Diarrhea, dysentery. But what is it that you have in Aesculus? Okay, you mainly have constipation. What is it? You mainly have constipation. Constipation, which mainly comes because of, I'll come to this. Constipation from portal stasis. Constipation from portal stasis, stools which are hard, dry, difficult to pass with dryness and heat in rectum. With dryness and heat in rectum. Stools are very hard, dry, painful and difficult. This is one part. constipation. The second very important part that can happen in Aesculus is the rectal veins can be affected, they can go into stasis, they can be enlarged, and what you see as a result of that is, you will be seeing hemorrhoids. Please go very systematic, very slow, don't get confused. Rectum, each remedy will have an affinity to produce whatever it can. If it is a diarrhea, cancer, anything can happen. But what is Aesculus capable of producing? Okay, individually, what is the remedy Aesculus capable of producing is very important. Okay, so it can produce constipation to start with, and then the portal stasis, then you have the rectal veins getting affected, and then slowly they land up with hemorrhoids. Okay, the hemorrhoids you already know. The rectum and the portal system are especially, see the beauty. This is what I was trying to highlight. The rectum and the portal system are especially sensitive to the effects of this particular remedy. So this remedy, the main area is the rectum and the portal system. Rectum and the portal system. Okay. So hemorrhoids, you all know how it. What is the character of hemorrhoids in Aesculus? Hemorrhoids which are blind, beautiful, correct? Blind is non-bleeding. Blind, purplish, or before you go ahead, or you might have bleeding, but the bleeding will be very minimal. Very minimal. Okay. See, tomorrow somebody will be talking to you about nitric acid. Tomorrow somebody will be talking to you about hemamylase. Fine. These are few remedies which are also very good for rectal complaints. But in nitric acid, you will have more of bleeding. Fine? You will have more of bleeding. Talk about hemorrhoids. Here, you have less of bleeding. Okay? So, hemorrhoids which are large, hemorrhoids which are painful, purplish, blind, burning, okay, groundnut-like. Fine? So, these are the characteristic things you will have to remember. Say, like groundnut. Actually, I should have highlighted this because this is the only remedy which has hemorrhoids like groundnuts. Okay, painful, very painful, so painful that the person cannot walk, so painful that the person cannot sit. Okay, and what is the sensation they have? Dryness, as if small sticks in the anus. As if small sticks in the anus. See, these sensations are very, very important. Fine, because they are individualistic. Okay, fine. So now you realize we cannot prescribe this particular remedy to a patient who has got allo symptoms. So allos is different, this is different, is what I want to highlight here. Okay? So moving ahead, hemorrhoids seen during pregnancy. Hemorrhoids seen during pregnancy or hemorrhoids which are also seen during menopause. Any other remedies you have in your mind for remedies during pregnancy? We discussed the remedies in first year. Can you recall some remedies? Not necessarily piles, hemorrhoids. I am asking a general question. Natal mirror. Good, koi baat hai, kya tha natal mirror? Very good, beautiful. See, I am happy. Hair fall during pregnancy. Okay, good. Pulsatilla, what was that? Correct, pulsatilla pregnancy. Good. What is there? Yeah. See, pulsatilla is a beautiful remedy for breech presentation. What is it? Breech. That you will be studying in obstetrics. But please make a note. Breech. Go back home and read breech presentation. And pulsatilla is a remedy, if indicated. We have cases where things can, the fetus can turn. And the lady who was advised C-section, she can have normal section. Normal delivery. Normal delivery. I am trying to tell this because my first daughter was a breech presentation, and then my teacher Usha ma'am prescribed my wife pulsatilla, and within 24 hours my daughter took a U-turn and it was a normal delivery. My gynec, my wife's gynec, she had advised her C-section. She called me and told Vijay, your wife might go into C-section.
That's when I gave a panic call to my teacher, Usha ma'am. And she said, Vijay, don't worry, give a pulsator. When we gave pulsator, and after probably 48 hours, we go back to the gynec, and gynec says, it's all fine. Your child has taken a turn. She wants to come back normal. Right? And that's the beauty. See, these are all the life experiences, I know what I went through 22 years, 23 years back. But then my faith in this system doubled, increased, because I am seeing my wife who was advised C-section after pulsatilla, she takes pulsatilla and she goes for a normal delivery. This is something which you cannot imagine. But we have beautiful remedies and it can do wonders. Right? So pulsatilla, when you said pulsatilla, I had that connect. Well, I don't know what you had in your mind. But I wanted to share this experience of my own. Beautiful remedy for breech presentations. Please go back home and read what breech presentations are. Any other remedy? Aconite. What will happen in aconite? Very good, beautiful, good. I'm happy. Fear during pregnancy. Aconite can have a lot of fears. Fear can come during any time. Fear can also come during the pregnancy. Fine. How will the delivery be? The pains. A lot of things. Good. Netremor, pulsatilla, of course, aconite. And then, now remember, in Aesculus, hemorrhoids during pregnancy. Aesculus can also have hemorrhoids during menopause. Any better remedies for menopause? If you want comparison, then you should start giving me remedies. If I tell, then you will be lost. Fine? So what are those remedies you need to think of? And see, all these things are important because slowly you will be introduced to gynecology. And gynec teacher will talk about menopause. Then you should relate as a homeopath. From the knowledge of materia medica, what are all the remedies that you can think of for menopause is what you should slowly start recollecting. Okay? So as a small assignment, please go back home. From the first year syllabus, please check what are all the remedies that can come for menopause. Okay? So we'll go ahead. What is this? Knife. Any remedies that come to your mind seeing knife? Huh? What is it? Calendula, surgeon's knife. Why did you think of calendula? Okay. Huh? Okay, beautiful. Lacerated wounds. Cut wounds. Good. Good. What else? Okay, what else? There are some remedies you'll be studying in second year. The moment they see knife, they feel like killing themselves, stabbing themselves. That is alumina. The moment they see knife, they feel like stabbing others. That is platina. If you have platina friends and if you have knife, please be careful. Okay, so platina will have an impulse. The moment they see knife, they feel like killing others. And this is what you'll be studying in forensic medicine. Killing others is homicide. Killing self is suicide. So alumina will have more of suicidal thoughts on seeing knife. And platina will have more of homicidal thoughts on seeing knife. So this is how you integrate. It's a beautiful thing. I just want you to be there with me. Trust me. It's a beautiful science, and you'll definitely enjoy. Right? Mix toxicology, mix forensic, mix pathology, mix gynec, mix organ. Take maximum whatever you can, and just make material medical interesting. Done? Okay, so let's get back. Here, the idea of knife. And where are we discussing the idea of knife here is in the rectum. So any quick thing that you can come up with. See, they have a feeling, knife-like pain. See the lady telling or see the patient telling, as if knife has been pierced and it shoots up the rectum. When somebody is pierced with a knife now, the kind of pain you get, that is the kind of pain Aesculus is getting. And in brackets, you should remember a remedy by name ignition. By name ignition. You can add ignition in the brackets. Not able to walk because of painful hemorrhoids, standing aggravation. Standing aggravation, which we just saw. And remember, in Aesculus, majority of the complaints are associated with back pain. I'll explain the back part a little later. But I want you to remember that hemorrhoids associated with backache, associated with back pain. Okay. Back pain, again, I have specifically shown you an area. From the knowledge of anatomy, you know it is not cervical, it is not thoracic, it is not, it is more of lumbosacral region. Okay. We'll go ahead and look at the back part of Aesculus. So as I was trying to mention, or I just mentioned, that the pains in the back in Aesculus is predominantly seen in the lumbosacral region. So lumbosacral region is very, very sensitive. Pains are excruciating, forcing the patient to bend. See, because of this back pain, he is not able to walk erect. He has to bend and walk. Which is other remedy? Sulfur is stoop shoulders. Good. I'm happy you thought of sulfur. But what is the situation I've given you? Because of pain. See, sulfur need not have back pain, but generally stooped. Fine? That is his physical appearance. Okay. This guy, once his back pain is fine, he can walk erect. Because of back pain, he is walking stooped. Okay. डायस्फेरा कैसा होगा? कोलोसिन में कैसा होगा?
बेंडिंग से
वो कोलिक में होगा. कोलिक में ना. तो मैं क्या बोल रहा हूँ? Because of back pain, they stoop and walk. That remedy is arnica. Okay. So we'll go ahead. Pains are excruciating. Back gives out during pregnancy. So a lady during pregnancy having severe lumbosacral pains. A lady during prolapse of uterus having severe back pain. During leukorrhea having severe back pain. When walking or stooping, she or he has severe back pain. And they must sit down or they must lie down. The remedy is Aesculus hip. Very sensitive lumbosacral region. Very important. Okay, as a second year student, you should slowly understand all these things, and we'll quickly look at the modalities, what aggravates. You must be doing few during and after sleep, lying down, on stooping, back it feels better, but generally stooping aggravates. 4 p.m. very important. You have some remedies, if you remember, from first year. Arsenic? 12 to 2. Okay. And you also sulfur. Leavening. Organ sensation in stomach at leavening. Sulfur. And then you also have Colocin. What time you had aggravation in Colocin? Colocin 4 p.m. Okay. And you also have a remedy when an heliborus, somebody will be doing. Lycopodium 48 p.m. So 4 p.m. you should also remember lycopodium. Lycopodium it is 4 to 8 p.m. specifically, but here complaints can start at 4 p.m. So what ameliorate? See, there is stasis, there is slowing down of the circulation. So any violent movement, violent exercise can make them better. Kneeling down, open air makes them better. Okay? So before we close, a quick recall. What is the action of Aesculus and veins? Stasis. Okay. Slowly dilatation, enlargement. Okay. Character of hemorrhoids in Aesculus? Blind, purplish, painful, burning, like rounded, or like a gravel. Gravel is what? Sand, like sand or like gravel. Very painful, cannot walk. Okay, good. And mention the backache of Aesculus. Lumbosacral area. Many complaints associated with backache. What are those complaints? Pregnancy, prolapse of uterus, leukorrhea, are simple. Hemorrhoids itself will be associated with backache. Okay? And recall the modalities of Aesculus. 4 p.m. during and after sleep, sensations they have in the rectum? Yeah, one is stick. Second thing is knife. Sensation as a knife is being pierced and sensation of sticks. You can't see sticks. You can still see something like groundnut. I'm happy you did not tell groundnut because groundnut is not a sensation. Groundnut is a reality. Reality means, the hemorrhoids are enlarged, resembling that of a groundnut. Okay, small swelling like a groundnut. Okay. So, moving further, as a second year student, second year material student, our main objective will be to integrate with pathology, to integrate this surgery, at least this remedy. I am specifically talking of this remedy. So please go back home, read stasis in pathology, and please go back home, read the topic hemorrhoids in surgery. So this is predominantly for external hemorrhoids. Which one? Aesculus is for external hemorrhoids. Okay, painful external hemorrhoids. So if you read hemorrhoids, it will become very easy for you. Done? So these are small assignments you will be going home and you will be doing. And you can also read head symptoms of Aesculus as an assignment. Okay, and we will discuss it in the next class. So at the end of the session, the learner is able to, are you able to recall the sphere of action? Yes. Pathogenesis? Yes. And are you able to list the PQRS? All of you? And are you able to describe the liver affections, the rectal affections and the back symptoms of Aesculus, and you are able to list the modalities. Okay? And we also made a small effort in connecting or in comparing similar remedies from your first year syllabus. Okay? Any quick questions, any clarification, anything you want me to ask? It's a small remedy. I wanted to start with something small so that slowly we build up and we take up serious or bigger remedies. Boys, clear? Aesculus. Girls? All fine? You don't have specifically. See, to be honest, it's a partially proved remedy. Okay, you don't get too much of information, but this is the basic information. What we say must know from the CBDC concept. This is the must know thing. Okay, I did search the ailments from. Okay, must be sedentary habit is one. Give me some time. I'll come back. I did try yesterday from source books. I did not get much related to ailments from. But sedentary habits can be one. Let me check and get back. Must be next Friday. I'll see if anything else that I come across, or even you can have a look and you can get back to the class. Okay? Anything else? All fine? Chalo, thank you. Things are fine? Thank you. We'll start with a new remedy, provided you have understood this in the next class.